House Republicans set to amp up the level here of debate over the budget. They're set to roll out their spending plan for next year and beyond, even before they've reached agreement with Democrats on a spending plan for this fiscal year. That threat of the government shutdown on Friday. For more on this entire debate, I want to bring in now one of the most respected voices on budget issues here in Washington, MacGuineas. She's president of the Committee for a Responsible Federal Budget. She's worked on Wall Street, advised to candidates from both parties. Maya, thanks for joining us now by phone. Appreciate it. Paul Ryan's plan set to be unveiled tomorrow talks about spending cuts in the trillions versus billions. What do you make of his plan? How is it going to change the debate going forward?
Well, this is going to be one of the biggest steps in the debate that we have seen in months. We have been focusing right now on sort of the government limping along on a couple weeks at a time. And this is going to jump us out of this year's budget into where are we headed for the next 10 years. And that obviously is a huge, huge challenge facing the U.S. We have too large deficits, too large debt. We have to make some changes, and we have a highly polarized political system that's going to make that tough. Congressman Ryan's plan, what we're hearing is that it is going to make big structural changes on our largest health care programs, Medicare and Medicaid, which is a huge step forward because these are the biggest drivers of the fiscal challenges we face. However, it's likely to be greeted as a very political document. It's not going to be the beginning of sort of bipartisan cooperation. Let's put this in place and fix our problem. Instead, it's probably going to be very divisive. And at this time right now, we're going to need to step past that and find a way for the two parties to work together to actually pass something to bring our debt levels down before markets at some point force us to.
Let me ask you about some of the specific ideas he puts out there. He wants to make Medicaid block grant programs for states, let them spend as they see fit. Talk to me about that specific change and how radical that is.
Well, it's a very, very radical changing of the way the program operates. And I think it also kind of dovetails with the issues that what's going on in the states is such a challenge right now. The states face their own fiscal pressures as well, where health care spending is squeezing out other parts of the budget. So if you block grant Medicaid and you give the money to the states and you give them more discretion over how the funds are spent, there will be all sorts of sort of health care advocates saying this is terrible, this is going to ruin the quality of health care for the low-income population, which is who receives Medicaid. But it's also going to give the states a chance to figure out how to save more money and operate these programs better. It could turn out to be a great way to test what's the most efficient way to make changes in health care programs. It will be a big battle.
His change with Medicare is an even more sweeping change here. What he's talking about is new Medicare beneficiaries would be able to essentially pick from private health care plans. They'd be subsidized by the federal government. The wealthiest Medicare beneficiaries, they would essentially be told, listen, there's going to be less money for you.
Well, that's right. So we know we're going to have to reduce how much we're spending on health care. Nobody wants to talk about it. Politicians tiptoe around this topic. But we are going to see less money from the government going to health care. Otherwise, it's going to bankrupt the budget. That's just the bottom line over time. So this approach would mean that consumers get the money, and they have to figure out how to spend it, again, bringing more of sort of a market force to the health care system that we don't currently have. This is actually a plan that's based on something he devised with Alice Rivlin, who's a very, very respected Democrat budget expert, and hopefully that's going to help bring the discussion, bring more people into the discussion, the fact that it's a bipartisan plan. But it will be a major change, not for current retirees, as I understand it, but for future younger workers, people going to be in the system down the road. They would have a very different way that Medicare would operate rather than just giving money directly to their providers. They would. Sorry,
real quick, do we have a budget shutdown on Friday?
You know, people are saying more likely yes than no. I think probably not. It would hurt both parties, but boy, is it going to be tough to hammer out the details to get a compromise in place in the next day or so.
All right, Maya MacGuineas with the Committee for a Responsible Federal Budget. Appreciate the time.